The Victorian virus scandal just gets worse and deadlier. 15 more deaths today. But there's now far more about this than just Victoria. This bungling state has become a national menace and has caused borders around the country to go up again. The coronavirus got out of Victoria's quarantine hotels, then got into New South Wales. Another 12 infections there today. And Queensland today said that's it. Visitors from New South Wales banned, except from the Tweed.
We've seen that Victoria is not getting better, and we're not going to wait for New South Wales to get worse.
And New South Wales says all its residents returning from Victoria, except from border towns, must now fly in to Sydney and then spend 2 weeks in hotel quarantine at their own expense.
Whilst the number of cases in New South Wales is pleasingly stable, we continue to be at high risk.
And it's no wonder that Victoria has terrified the rest of the country. Today, it set a new record for daily infections, 729. And that suggests that the kind of tough bans that the Victorian government has put in over the last few weeks have not worked, or not nearly as well as expected and predicted. Victoria's new record is more evidence that forcing people to wear masks and stay at home and smash all these businesses, it doesn't tend to work for that long. It is 2 weeks since all Melburnians were forced to wear face masks, even outside, where the risk of transmission is actually close to zero. It is nearly a month since the city's restaurants were closed, and its 5 million people were ordered to stay in their homes, if not working or going out for essentials. And if these were magic bullets, these face masks and these stay-home bans, they missed. The Victorian approach, as I've tried to warn for ages, has been a disaster. It's been tough on what makes no difference and slack on what works. So, what are the glaring problems that should be fixed? Well, I'm repeating myself, but this is what's so damn frustrating. I'm repeating myself. It's so obvious. The first thing that went wrong, the face mask ban. As I've said, many studies have warned that the face masks give only partial protection, but give wearers a false and dangerous sense of security. You've got to keep your distance. Another failure is home quarantine. As I said, for months, it has been disastrously slack in Victoria. On Monday, we learned that 1 in 3 infected people weren't at home when health teams came knocking on their door. God knows how many went out during the day when the health teams weren't there. And who knows how many people they infected. That brings me to another problem. People are actually getting sick of these bans on their freedom. It's gone on for months. They don't want to live like that, not for month after month. And you can yell at them all you like about being selfish, etc., etc. We're all in this together. But people need human contact. So many now do break these rules. And that forces the government to increase fines to make them comply. It forces the government to look more and more like a police state. But in getting tougher, the Victorian government is also causing enormous harm. It's just shut thousands of retail shops now. 250,000 more people this week thrown out of work. And there's a fourth huge problem. And it's one that almost nobody has pointed out, yet it's so obvious. No state has tested more people than Victoria. None. But on the other hand, no state has anywhere near as many infections and deaths. So this testing is clearly not the charm. It's clearly not working like the Victorian government thought it would. And how often have I pointed out why? In a minute, I'll talk about an exciting development here, by the way, a potential lifesaver, an answer, potentially, to the Victorian government's prayers, should it have any. And it's something the Victorian government should have been grabbing onto with both hands, other states too. But let me first spell out this problem with the tests. Victoria's virus tests take too long. The sick are at their most infectious in the very first days of feeling ill. But it takes between 1 to 3 days, from 1 to 3 days officially, in fact, sometimes even 9 days, to get results once they bother to go to a testing centre to get the swab up the nose. And that is too late. How many people have they infected in the meantime, and how can the government possibly trace them? Now, if only the government had done the basics, but done them well. Tougher quarantine, more effective testing, and better protection of those most likely to die. Now, on that point, stopping the dying rather than brutally and crudely trying to stop the infection everywhere. This Victorian government is so deceptive. It today announced 15 new deaths, the most in a single day. And it seized on the one outlier. Someone in their 30s had died, the youngest victim in Australia by far. And apparently this tragedy proved that this virus could kill any of us.
You know, we're terribly saddened by this, but hopefully no one misses that point, that this is something that's not just of those who are frail and aged. It can be deadly, and it has been deadly here and around the world in people of all age groups, and indeed people that are in otherwise good health.
But hang on. Until now, this virus has killed only a handful of people under 60 and not one under 40. So were there perhaps other health issues with this particular person that explain this very tragic but very unusual death? On that, the Premier refused to say.
I think you'd understand that we have to be very much guided by the wishes of the family. But if we can get further information for you, then again, it's not about wanting to be anything other than transparent, but I just think you've got to be incredibly careful not to be going against the wishes of family, and everyone will have a different view and complex circumstances. Now,
I can see why the government wants to promote the scare that this virus kills anyone. Could happen to any of us, any time. And why it would want to say that no one could predict who would actually die, that these mass bans on everything and everyone everywhere are indeed what's needed. But that is rubbish. Yes, this virus can make anyone sick. And yes, overseas it has killed some children too. It is dangerous. But the fact is that overwhelmingly it kills the old. In fact, most of Australia's dead so far have been older than 82. And more to the point, of the 162 Victorians who have died, 162, at least 137 were in aged care homes or services. 85% of Victoria's dead were exactly where this government and the Morrison government should have known from the start would be the killing fields, aged care. And 1,400 more residents of aged care homes are now infected. I expect hundreds more to die. The headlines for a long time are going to be very bad. These homes should have been sealed tight months ago. This was not rocket science. I've called for this since April, and this is a complete scandal. We could have stopped most of the deaths by better protecting aged care homes and helping old people who live at home to stay safe there by doing, say, their errands for them. A warning to the rest of Australia. Have your governments learned from this disaster in Victoria? A government weak on what works and tough on what doesn't.